Alright team, here are the symptoms we're dealing with. Gingivitis, musculoskeletal injury, and vestibular adenitis.
Based on those symptoms, I think it could be something related to an autoimmune disorder.
I'm leaning towards a neurological condition, given the combination of symptoms.
What about a rare genetic disorder? It could explain the diverse range of symptoms.
I think it might be a systemic infection causing these issues.
No. It's primary lateral sclerosis. I'm sure of it. We need to act fast.
Are you sure, Hawks? The pull-through procedure is extremely risky.
I don't know if we should go through with such an aggressive treatment without further confirmation.
I agree, we need to consider other options before putting the patient at risk.
This feels reckless, Hawks.
Are you sure about this diagnosis?
Damn it. I've never been more sure about anything in my life. We're moving forward with the pull. Through procedure. We can't afford to delay any longer. Tracy, you wanted to see me?
Yes, Hawks. I heard you want to perform a pull through procedure on your patient with what you believe is primary lateral sclerosis.
That's correct. I know my patient, and I believe this is the best course of action.
Hawks, you know we have to consider all possibilities. You have a track record of jumping to conclusions.
How dare you question my years of experience and expertise? I know what I'm doing.
I'm not questioning your experience, Hawks. I just want to make sure we explore all options before proceeding.
I don't have time for this. I'm going to do what's best for my patient, with or without your approval.
Hawks, I'm just trying to prevent any unnecessary risks. Let's talk this through before making any hasty decisions.
Leslie, the patient is in critical condition. I just checked the results, and it's clear that the pull-through procedure was not the right treatment for primary lateral sclerosis.
Well, that's not good. But our priority right now is the patient's well-being. We need to focus on that first.
I know, but we also need to consider how we're going to tell Hawks about this. He was so confident in this treatment plan.
I understand your concern, but we have to approach this delicately. Hawks needs to know, but the patient's health comes first.
You're right, Leslie. Let's focus on making sure the patient gets the care they need, and then we can address the situation with Hawks.
What were you all thinking? You nearly killed our patient by choosing the wrong pull through procedure and the wrong diagnosis. You call yourselves diagnostic doctors. We're like incompetent fools.
But Dr. Hawks, we were all just trying to do our best to save the patient.
I still think the problem was with the patient's immune system, not the procedure.
Actually, I believe the issue lied in the patient's hereditary factors. That's why the procedure didn't work.
I agree with Leslie. It was definitely more about the immune system than anything else.
You all have no clue what you're talking about.
You should have known better. I can't believe I even have to work with such a bunch of morons. I'm out of here.
Have you tried that new sandwich from the cafeteria? It's pretty good.
Yeah, I had it yesterday. Not bad. So how's your personal life outside the hospital going?
Oh, same old routine. Nothing much to report. How about you?
Honestly, it's been a bit hectic. Trying to balance work and family time is not easy.
I get that. Family is important. But hey, speaking of work, I've been working on this puzzling case that just doesn't seem to add up.
Oh, really? What kind of case is it?
It's a complicated one, but I think I may have just figured it out. Excuse me, Johnson, I need to go check on something. I'll catch up with you later.
Wait, what? Hawks, where are you going? What about lunch?
Sorry for barging in, but we don't have time to waste.
We need to address this right now.
Hawks, what are you thinking? You can't just enter the operating room without proper gear?
This is unacceptable, Hawks. You're putting everyone at risk with your reckless behavior.
He's right, Hawks. We have protocols for a reason. You need to follow them like the rest of us.
Listen to me, the diagnosis was wrong. It's not primary lateral sclerosis, it's nodding disease.
Nodding disease? I've never even heard of that. What's the prognosis?
The prognosis for nodding disease isn't good. It's a serious condition with no known cure.
We need to act fast then. We'll need to prepare for intensive treatment and management.
All right, Hawks. Let's get this under control. But next time, don't storm into the OR like that.
Thanks, Tracy. It was definitely a team effort to get to the correct diagnosis.
I'm glad we were able to figure it out in time. But we need by less idiotic doctors.
I just wish some of my colleagues had a better grasp on medical knowledge. It could have saved us from this whole mess.
But Hawks, you were the one who initially misdiagnosed the patient.
Well, my team should have double-checked me. We're all responsible for ensuring accuracy.
You can't blame others for your mistake, Hawks. Own up to it and let's learn from this.
I need some air. Let's reconvene later.
Hawks, come on. Running away won't fix things. We need to address this together.